Hi, this is Veronica Brill. I'm a registered nurse and I'm the founder of Blenderized RN. As many of my Blenderized RN group members know, Dee was diagnosed with cancer and passed away less than 6 weeks later because we found out when it was too late. My son was nonverbal and unable to communicate some of the issues he was having. So today I wanted to make a video about the cancer warning signs that I saw. This video is not meant to diagnose your child, and it is not based on medical research. I am merely showing you the signs that I saw that led to the tumor diagnosis. First, I'd like to let you know that Dee's cancer was a Wilms tumor that started in his right kidney. One of the first things that started happening was Dee started looking swollen. And he was never a tiny child, but he was starting to look swollen in all of his pictures. It was very gradual, but looking back, I can tell the swelling started about 4 to 5 months before his diagnosis. Along with the swelling, I started noticing that he was gaining weight. I hadn't changed his diet in over a year, and I was perplexed as to why he was gaining weight. I remember recalculating his diet quite a few times in the summer and slowly reducing his calories, and he was still gaining weight. With the weight gain came a distended abdomen. Dee was a low-tone child, so he never really had a tight core, but it slowly became quite distended, and a lot of times we thought it was due to gas or something he ate, which leads me to the bowel changes that I noticed in Dee. Dee was on a seizure control diet, which was low in some carbs, and always had a problem with constipation, but it seemed to have gotten quite a bit worse about a month or two before his diagnosis. He also had a lot more gas than he ever had before. I never had to vent him, and I was starting to have to vent him a lot. I had to do a lot more abdominal massages to help him pass gas, and he had never had this much gas before. Dee would start to get these fevers without any signs of infection or chest cold or anything, and then they would just randomly go away. When I took him to the pediatrician, all of his labs, urinalysis, and urine culture came back normal. Dee was generally a pretty happy and sweet child, and I started to notice he was getting a lot more grumpy. He had grumpy days before, as all children do, but it was starting to become more and more common as we got closer to the diagnosis. The last thing that happened was I found blood in his urine. We took him to the pediatrician because we had assumed he had a bladder infection, and his urinalysis and urine culture came back normal. I ended up taking him to the emergency room where all of his blood work and urinalysis and urine culture again came back normal, and they almost sent us home, but they said, let's just send him for an ultrasound because it's probably a kidney stone. Ultrasound showed that there was a tumor, and then after the MRI, we got an even worse diagnosis, that the cancer had spread already. Looking back now, everything happened so gradually that had I put everything together sooner, I may have found out his diagnosis before it was too late. I hope that if anyone else sees all of these warning signs, they take their child to the doctor and insist on more tests. I miss him so much, and I hope this doesn't happen to anyone else. He was truly a joy and a very amazing child, and I hope this helps someone else.